This video will demonstrate how to manage your participation in the National Bowel Cancer Screening Program. The page has 3 primary tabs relevant to your participation in the program. Program Details displays how long you have been participating in the program and notification of any unread messages, the last time you screened, when you're next due to screen, and notifications if you're overdue or there are any recommendations following your last screening results. You can order a replacement bowel test kit to your address if your last kit was damaged, misplaced, or it has expired, or request a replacement participant details form. If you're aged between 45 and 49, you can also request your first kit be mailed to you and start participating in the bowel program. Opt out of the program if you no longer wish to participate. You can resume participation at any time via the portal. Defer your next screening date, perhaps because of travel or health reasons. Update your communication preferences if you would prefer to be notified by SMS or email when you have a new message in the participant portal instead of receiving mail. The My Details tab allows you to update your personal details recorded with the NCSR. It's important to note that this will not update your details recorded in Medicare. To update your Medicare details, go to servicesaustralia.gov.au/Medicare. You can nominate a healthcare provider for the programs you're participating in and nominate a personal representative to manage your participation in the bowel program on your behalf. You can update your Indigenous and country of origin details if applicable, and also update your communication preferences. The Messages tab displays all previous correspondence sent to you for the bowel program.